Hello, everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us today for this insightful session named as The Big Idea Voicing What's Next in Healthcare. So, this episode is a mini virtual, crisp yet insightful interview series where we feature leading healthcare experts and innovators who are making a significant impact in the healthcare space. So join us as we'll be delving into their valuable insights and experiences. And to mark this today, we have a very special guest joining us, Mr. Vasu Goel, who is a visionary CBO of Sugarfit. Mr. Vasu leads and builds Sugarfit's efforts in transforming diabetes management through innovation, digital solutions, strategies, and patient focused care. His strategies, visions, and expertise are driving the future of healthcare management by making significant strides in improving the outcomes. So, I would like you all to please join me in welcoming Mr. Vasu Goel. A very good evening to you, Mr. Vasu. Welcome to the show.
Hi, thanks, Dr. Sumedha. Very glad to be here. Privileged to be a part of this panel discussion.
You're welcome, Mr. Vasu. So, to begin with the discussion, and before we delving directly to the discussion, first we would like to know about your journey from an engineer to a CBO, especially in the healthcare space.
Uh, yeah, no, I think over the last 7, 8 years, I spent a lot of time in consumer-facing, products, solutions in the e-commerce space, and then in the healthcare space. I'm a passionate problem solver. When I started delving deeper into the healthcare space, the kinds of problems that patients face today in different scenarios, I was pretty much attracted to the chronic management space, right? Especially how diabetes, hypertension, heart health, and a lot of similar conditions exist and what patients do. And I was just fascinated by the kind of problem statements that are there and how it's broken up in the current ecosystem of India. And that's where I got interested. I joined CureFit, erstwhile CultFit, to lead their CareFit operations, which was their primary care business that we were launching. Ran it for a couple of years. Unfortunately, due to COVID, we wound it down. But that's where we came up with the idea of Sugarfit. So it's a privilege to be a part of an amazing team here at Sugarfit, building it up from scratch and seeing the latest advancements in chronic management space, chronic care, diabetes management space that's happening across the globe. Brief about me, what I did. If I talk about Sugarfit, over the last 3, 4 years, Sugarfit as an idea, was conceived in 2020 in the aftermath of COVID. I'm sure everyone, all our seekers would know that the devastating effects of conditions like diabetes, hypertension had on people who contracted COVID, right? Especially the mortality factor. People with diabetes
Yes.
were very afraid of contracting COVID at that point of time because of the high adverse effects. And that's where we started understanding the the importance of managing it, the importance of taking care of such conditions in much more depth. Interestingly, COVID also accelerated a very few important aspects related to the delivery of healthcare. One, the adoption of telemedicine amongst users across the country, was significant during that 1 2 year period, and it also enabled access to great quality providers, care providers in the remotest of places across the country. Second, I think the awareness of the condition, just the comorbid conditions, diabetes, hypertension, amongst the people and its potential impact on their body in the long run, boosted, and a lot more people were aware. And third, now people were ready to act on it. They don't want another epidemic to come in and get scared about it, so they were ready to act on it. And that pushed us as a team, the team that was working in the primary healthcare space at that point of time, to look deeper into this kind of a problem statement that is diabetes at large, right? And we started Sugarfit. As you delve deeper into the problems that a user faces, we realized that the existing market was fragmented. Most parts of healthcare delivery was working in silos. a patient had to traverse the journey, to a doctor, to a diagnostic, to a pharmacy, to a nutritionist, to fitness on their own. And the cognitive overload to do all of that was significantly high for them. And this led to very low motivation for people, or sustained motivation for people to get good outcomes. And hence, they were resigned that, okay, this is a disease that I have to live with throughout my life, and keep waiting for its progression to happen over next 10, 15, 20 years. And that was the core hypothesis of what helped us build Sugarfit to what we are now today, right? Uh, that became the cornerstone of what Sugarfit is solving in the long run. We want to provide something more evidence based, something more scientifically crafted, but a journey. From a user's point of view, it is a seamless integration in of their life with hardware, software, analytics, and human care, all delivered at their home, in their at their fingertips, yet helping them achieve outcomes. So Sugarfit aims to reduce sugar levels for people, help them reduce their reliance on medications, and be able to live a much better quality of life in the longer run, right? Not be bound by it, but be able to live with it much more freely, right? And that's how my journey has played out, building out different aspects of it, the clinical journey, the operations part of it, the business part of it, over the last 7 8 years.
Well, thank you, Mr. Vasu, for sharing that very fascinating and diversified journey of yours with us. And this is actually very incredible to see you from an engineer background, and now you are influencing the healthcare management for the betterment. Moving ahead, I would like to ask that we all know India is often referred as the diabetes capital of the world. So, in this context, how do you view this, and what insights would you like to share about the upcoming opportunities and challenges present for the diabetes in terms of providing better solutions?
God. You said it right. Well, it's not a hidden fact anymore that India is the largest diabetic, population in the world. And you will see a lot of studies that mention that we have people with over 100 million, 100 million people having diabetes, and a very similar number having pre-diabetes. That's almost one in every four people in the country affected by it. Now, what does that mean for us as a nation, right? From an opportunity standpoint, this means that there will be a lot more innovation in delivery of healthcare, in number of healthcare providers to assist for the same, new treatment protocols, medications, new care devices that will come up in the market for users, right? So next 10 years or next 15 years will also be a decade of healthcare where people will have access to a lot more of these things. But while the opportunity is very large, from a healthcare provider perspective or a healthcare industry as a whole, it also points to a very high burden on the healthcare institutions across the country in the long run, right? High numbers would lead to high loss of work productivity among the working population. We boast of the demographic dividend that we have, but with more number of people having these conditions would mean that more number of people losing productivity in work. Higher number of complications and severity of secondary and tertiary care requirement will come up, which will mean the increasing overall costs if not acted on the right time. Right? If you look at it over the last 2 decades, is when we've seen the significant rise of diabetes, right? Especially in a nation like India. So all of those will point towards a burden that we will all as a nation have to bear. Also, at this point of time, the coverage of insurance amongst the population and the access to care is also not that high. So it will inadvertently affect larger lives if not acted on the right point of time. Right? And if you look at it from both point of view, opportunity and the challenge, the biggest challenge today is not just being aware of the disease, right? I think people who have it are very much aware of what is going on, but the urgency to act on it, since diabetes is not something that's affecting you immediately in the very short run, right? It's a slow progressive disorder that comes over your body over a longer period of time. uh, the lack of prioritization of your own health, in the overall stack of your life, will lead to a lot more issues, right? So we lag a lot on prioritizing our own health, even if we have disease, right? And that is the biggest challenge I think we will have to overcome as an industry, as a nation, to prevent diabetes to have a long lasting effect, overall in the country.
Thank you, Mr. Vasu, for sharing your perspective on the diabetes landscape in India. And like the way you enlightened the scale of both challenges and opportunities in this context is very insightful. And you said it very right that people in the India are aware about their disease. But what to do next? What should be the action? This is the challenge, and there are so many co-hypotheses are playing role in their lives. Moving ahead, so if we talk about the challenges in diabetes management, so what are some of the key challenges that Sugarfit has faced and healthcare providers are facing in diabetes management? And how can these obstacles be addressed? Like what solution, what approaches can be proven effective in the outcomes?
Perfect. Yeah. No, I think more than just Sugarfit, I think all healthcare providers today are burdened with very different types of challenges in this space, especially healthcare. Uh, the biggest one, I think, the sheer ratio of care providers to the patient today is, a big impact. The access to a good care provider, the time taken by the care provider to be able to give legible solutions to patients is a function of the ratio. And today, I think we require much more care providers, both in the preventive and the curative space. Second, I think access to proper medical records, especially in tier two, tier three, tier four cities where people do have physical, but the entire history of a patient doesn't get created for care providers to look at, make informed decisions basis on that. And that creates a snowballing effect, right? Doctors have to look at the recent report to be able to take a call on what medication, what kind of treatment to be provided, and a lot of history is not looked at. Uh, these lack of medical records also lead to some poor quality of treatments in specific pockets, and that is something that as a care provider we all face a challenge. Another thing I think is lack of entire technology layer across user journeys. Be it testing, be it meeting doctors, care providers, getting treatments done in different places. All of that journey is not available for a new care provider in the patient's journey to look at and take more informative calls, right? So and that reverts back into a user's motivation. A user not being able to see credible solution maybe after 3, 6, 12 months of treatment, their motivations keep going down, their focus on managing of that condition keeps going down, while the cost of managing that keeps going up, right? They keep have to shelling more money now, keep getting the different kinds of treatments, and that inadvertently affects their mindset in the longer run, right? And these challenges also lead to burden on both the public and the private sector healthcare providers, eventually leading to burnout of maybe some healthcare professionals, different care providers, the staff that is available, which is not a good sign, right? In this specific industry. I think one of the biggest solution, to solve for that lies in the use of technology and using technology platforms to deliver proper healthcare. And maybe this also goes back to my motivation from being an engineer coming into the healthcare space, because being a technocrat, I believe that technology builds or brings those kinds of solutions. Technology is not just software or apps that are available for people. It's also in the hardware that's available for people to be able to use and monitor the conditions better. It's in connection or communication. People are able to communicate well with their doctors now, through voice calls, video calls, WhatsApp. So there are so many layers of technology that are available now. But how do we use that in a more seamless way, in an integrated way, for a patient to be able to follow through a journey and have records that are available to their care providers, doctors, nursing, everyone in a seamless way, so that all decisions are taken much more hyper personalized for that patient and not in a generic state, right? I think adoption of tech at ground levels, digitalized prescriptions, digitalized lab records, medications, all kind of care treatments provided will help with the continuity of care of users across the journey, and this will definitely lead to much better outcomes. And that's where maybe the space of Sugarfit is. We as a company are a tech platform to provide diabetics in their journey, a seamless journey of management, of remission, of reversal, through educated treatment mechanisms that care providers like doctors and coaches who are working with these patients take, use of data, coming from different devices that we use, different logging mechanisms that patients have. So all of this compiled together and come back to the care providers, and we are able to give much more hyper personalized solution. And that is something, one of the first barrier that we are trying to break, in this healthcare industry.
Well, thank you for such a comprehensive overview, Mr. Vasu. So it's great to hear about the specific challenges and in diabetes management and how Sugarfit is addressing them. And I think this approach and solution are clearly making a significant impact in such a crucial area. Like we all know that India is the diabetes capital. And since you mentioned the future advancements, technology role and everything, I would like to tell us about like what upcoming advancement or innovation or industry trends I would say in the specifically diabetes sector and wellness do you foresee will have the most impact on the healthcare industry, and how do you plan to integrate these developments into the strategy to enhance the patient care and support?
Got it. Almost all new emerging innovations that are coming in space of diabetes today are, I think, technology-led. Especially if I talk about chronic management conditions, and technology in three forms. One is, like I mentioned earlier, hardware. People which they can wear on their body, on arms, like wearable sensors, smart wearables, to create data of an individual by large, right? So that is, I think, the first level of technology that is coming in. The second one is more software, which is more integration layers, which integrate different levels of care providers or doctors, nursing staff, hospitals, clinics, everyone together onto a platform, so that ease of sharing of communication, ease of sharing of information is much higher. And third is hyper personalization or insights based on each individual, right? AI today is able to mimic a lot of metabolism of a person and is able to give that, okay, this is what is required for specifically an individual, maybe a patient, Vasu Goel, going through this kind of a condition requires this kind of a treatment. So all these three kinds of solutions that are coming in are working together, and these are the innovations that are coming in the space, very, very rapidly. Just talking about diabetes, I think one of the biggest innovation that maybe have happened in the last 7 8 years is the usage of continuous glucose monitoring. Right, everyone has been monitoring their glucose levels through prick, which provides like a snapshot of a point of time of a user's glucose levels, but it still doesn't allow the care provider or the doctor to be able to make much more detailed, informed decision about their lifestyle, what is causing the spike, when is it coming in, what is causing night hypos, and so on. Right? But this small sensor that people can apply on their arm is able to give a full insight, for up to 14 days. And that insights, when it is coupled with, like I told, AI technologies and empathetic human care by coaches and doctors, we can deliver much more personalized outcomes for people, right? And that is what Sugarfit has been hyper focused on. How do we integrate all of that? All of these emerging innovations, if you would see, are some part integrated in our program. We get thousands of data points from devices, we get points from user logging, so users are able to log their different activities on the app seamlessly, their food, their fitness, their medications. That also creates a lot of data points for us. All of these data points go into care providers, which is your coach and doctor. They are able to see the different insights basis on all of this data point, and are able to give much more hyperlocal solutions, or something that works for them. Outcomes, in our perspective, outcomes, delivery of outcomes, and outcome would mean maybe better sugar levels, reduction in medications, better comorbid conditions, or improved, comorbid conditions while you have diabetes. All of these are significantly higher when these emerging innovations are working together in tandem for people. And there's still a lot of ground to be covered to make these innovations, available at large for public. Large scale awareness programs on maybe diabetes management, revision, reversal, counseling on taking actions immediately, like I mentioned earlier, right? Take
Yeah.
immediate actions and not wait for them. Uh, yeah, better ingredients of nutrition. I think everyone now knows good nutrition and bad nutrition, but they are not able to make that call. So they need more awareness on those. How to make fitness more effective. I think in a traditional segment of Indian market today, fitness is largely equated to walk. But walking just alone will not lead to fitness that we require. The kind of energy consumption we need, or calorie consumption we need to be more aware of the different levels of fitness that everyone needs to be done. So all of these are different advancements or innovations that we will have to focus on as an industry, as care providers. How do we do it at scale? India's population and the growth of diabetic population has been significant, so we have to make it mass. We have to find solutions for scale, and some of these technologies will be able to help us scale rapidly.
Yeah, very rightly said, Mr. Vasu, and thank you for sharing such insights. And it's really exciting to hear about the advancements and how Sugarfit plans to integrate them and the approach to incorporating these innovations. And I think this is the correct approach to target, and how precisely you are getting into all of that is really insightful. Moving ahead, I would like to ask, since you have expertise in business strategies and making the business impactful, so according to you, how can new startups and established company in the healthcare space can come up to address the challenge in the healthcare management? And what strategies should digital healthcare providers adopt to drive innovation and create meaningful solution in this space?
Got it. I think healthcare is one of the amongst the toughest spaces to work from because of course, regulatory guidelines. The nature of solutions that we want to provide, because it impacts people's lives and lives at large. A lot more. A lot of innovation, a lot of business strategies should be driven primarily by user outcomes, right? If we are in healthcare, people are coming to institution to get better health, right? They are looking or seeking a credible solution for that. So all companies who are coming in, or people who are coming in this sector, need to put user outcomes at the core of the strategy, product development, business along with it. While we try and create good quality solutions, we have to keep cost and affordability in mind. Today, the best quality of medication or best quality of devices may not be available at large. So when we are thinking of solutions, we have to also keep in mind the cost, the willingness to pay, and the quality that we want to provide, right? So those are the parameters that go in when we start designing different strategies. For us at Sugarfit, I think user outcomes was the core of designing whatever we wanted to do, right? And we started building it backwards. So let's say a diabetic today, what do they yearn for? They yearn for a normal life. They yearn for, to be able to eat normally when they're going out, not to be worried about different episodes, not to be worried about medications for long, right? So those were the insights we picked up and started building our strategy. That how do you prove results? You prove results by continuously monitoring them, giving them the right guidance, giving them personalized solutions, ensuring that their motivation sustains for not just 1 to 3 months, but long, 12 months, 18 months, 5 years. So those are the kinds of the insights went for us. I think that's similar to all other levels of different kinds of solutions that are coming in. There is a huge scope on building multiple solutions together, as an ecosystem to be able to solve for this problem. For example, one of the core approaches that you know institutions like hospitals, doctors, or clinics can take it. How can they work with platforms and seamlessly integrate technology into their practice? So if I am running a clinic today, how can I give access to better wellness, better nutrition support to all my users by integrating into different companies who are solving for that? So if I'm an expert for wellness, how can I give access of that to our patients? So making people aware with the right solutions is also important. So a fully integrated ecosystem in healthcare, maybe multiple platforms which integrate care providers, insurance, uh, doctors. but keeping the thread of user outcomes as the goal, right? Not becoming a marketplace alone. Marketplaces are great. People have access to a lot of information, a lot of different solutions. But how do they, stitch together into a journey is something people can think of when they're looking at health sector or building strategies in this segment. Like I said, I think consumer outcomes is the core principle of any new strategy to develop and to build problems at scale.
Thank you, Mr. Vasu, for sharing your insights very ethically, I would say, in terms of patient outcomes and results. Moving ahead to conclude this, I would like to ask what key strategies or approaches do you believe are essential for healthcare organization to adopt in order to remain competitive and drive innovative in the healthcare management sectors over the year and for next upcoming years?
Uh, I think to be competitive, right, and to be able to provide credible solutions, one is providing the right solution, right? You cannot just, because there is a lot more patients, we cannot just build up solutions that offer them some kind of a solution. It has to be a full-fledged solution. To be able to be competing in this, we have to build right trust and brand, right? In healthcare, in the longer run, since it's a supply-driven market, because care professionals, doctors, all top KOLs are part of that journey. It's important to build the right trust, and for businesses to have that competitive advantage, it comes from the percentage of people seeing outcomes through your solutions. For example, if someone is coming into Sugarfit, or thousand of people are coming into Sugarfit, at least 90-95% of them seeing credible results, reduction in medication, improved glycemic levels, is something that we strive for. And so very similar, for example, if someone is doing surgeries, then post surgery, of how many people recover, the surgery outcomes, those are the things will help people become competitive. Second, I think while we build trust in brand, the second most important competitive edge that people will have is doing things for scale, for masses. There will be some niches which can work independently as high premium luxury kind of solutions. But in India, if you want to build something for the masses, you will have to build for scale, which will mean that you will have to have invested in the right technology upfront. You should be able to build or scale your solution what you have today to 1,000, 10,000, or a few million users in a span of 1 to 2 years. So investing early on technology in the right time frame will definitely be a strong competitive edge. And third, I think it boils down to people. Having the right set of people with the right skills, doing the right job is more important, especially in healthcare. And we see a lot of interoperability in healthcare space where different skill set people are treating different patients. In the long run, I think having that kind of a match for patients will be very important, and that's where all of the organizations can build a separate moat. Building brand trust, building the right skill set, building technology from day one will help people have a very strong competitive advantage over the next 24 months or so.
Well, thank you, Mr. Vasu, for such insights. And it's very clear that adopting the right business approach is crucial for driving innovation and staying competitive. And I'm sure that these perspective that you provided with will undoubtedly guide many organization and seeker in order to navigate the future of healthcare. And we appreciate you for sharing your expertise with us today. So thank you so much, Mr. Vasu, for such insightful discussion.
Yeah, no, thank you, Dr. Sumedha, for having me here. Really excited. And I hope that this helps a lot of users across.
Yeah, thank you. Thank you, Mr. Vasu.